Our goal was go fast, organize, and be able to go into phase 1 clinical trial in 100 days. And obviously we exceeded that expectation and goal with 66 days. Most of what really prepared me and us really is the work that even started before I got to the Vaccine Research Center around SARS and MERS and how we might make the best vaccine for a virus that might be akin to those two viruses. We'd studied how to make the vaccine design. We'd studied the type of platform that we might want to deliver that vaccine design. And so when it became clear that it was time, everyone just essentially dropped everything else that we were doing in our small team.
We've gone through this drill a few other times, trying to get our vaccines into the field in time to get an answer before the outbreak waned.
MERS,
Ebola,
Zika,
SARS,
Nipah virus.
During that period of 2014 to 16 or so, we were working on the structure of spike protein, again with Dr. McClellan. Finally solving the structure of the endemic coronavirus HKU1 allowed us to see the structure well enough to start designing stabilizing mutations, and that was done and published in 2017. And those stabilizing mutations are the basis for our work during this coronavirus outbreak.
So my interest in emergent infectious viruses is particularly what are the steps which facilitate this transmission from, for instance, like ducks or dromedary camels or bats into the human population. We're now a married couple for quite some time already, but we're very complementary to each other.
We did this work together, but Vincent's main thing was the vaccine. And my lab's main thing was antivirals, actually. With MERS coronavirus, we started working on some animal models, which are really important. We were actually the first people to establish an animal model.
And by doing like field research in the Middle East, in Qatar and Jordan, that gave us a lot of expertise in working with coronaviruses, vaccine development, which really made us like in the right position to start working when SARS-CoV-2 or COVID-19 came along. We were able to provide the world with the first basic information on this virus within 11 days, and a breakthrough speed, I would say.
Yeah.
After the experience with Zika, we developed a plan for us to do what we call a prototype pathogen approach to pandemic preparedness. And all that work helped put us in a position to have a better design for this vaccine that we're developing now.
Early in January, we already decided if this really turns out to be a coronavirus and we can get the virus, these are the things we do.
So there was already a plan. So the next 3 days after the sequence came out was really around organization. So we were ordering mice, we were ordering DNA plasmids, we were starting to think about how we would optimize different assays. The pace at which we are going.
It was very intense.
We did come in at certain nights as well.
So that allowed us to quickly move, and we had clinical grade quality material back from Moderna within 41 days or 42 days after the sequences were released. In a crisis like this, we try to save days as much as we can because those days add up.
All of these laboratories coming together to make one solid thing. It's happening now because every single scientist, especially in the world, wants to make sure that we get through this. And I think it's very clear that science is the only way that we will.